We realize fully that many of our CHW colleagues work outside of the healthcare system. We know that many of our colleagues work on many diverse endeavors, such as literacy programs and environmental justice efforts, and anti-violence programs, prisoner reintegration efforts, and many, many other settings. Some of our colleagues work solely on community organizing and community building efforts. We know this, and we've been very diligent and thoughtful in our efforts to ensure that all possibilities are represented and included as we look to standardize our workforce and gain recognition. But we have also always known that the main challenge to advancing our workforce is the way that we fund health and wellness in this country. We fund short-term, categorical, disease-specific efforts. That's what we do in the United States of America. We fund diseases instead of wellness. And we fund projects for short-term effects. And this has all led to an instability in our workforce because CHWs work with a more holistic understanding of health, as Maria's story demonstrates. However, even if you do not work in the healthcare system, the Patient Protection and Affordable Care Act still provides opportunities to provide stable financing as payment for healthcare shifts from payment for incidents of care to payment for outcomes. More on that later on this afternoon. On another note, for those of you who do work in the healthcare system, this is a very special time. The passage of the Affordable Care Act offers enormous opportunity to advance our workforce and integrate more completely with emerging innovations in the delivery of health and social services. It is notable that the ACA actually mentions CHWs. The Affordable Care Act, which is the law of this land, mentions CHWs as both health professionals and as members of the healthcare workforce. So for those of you who thought we were para or quasi or almost, sorry, the law of this land says we're health professionals. So last year, we succeeded in a national campaign to gain recognition for CHWs by the federal government, and we now have our own unique occupational category, standard occupational classification. Together, these two pieces of federal policy should help ease some of the confusion amongst those of you who think that we're not professionals, that is. But even those of you who do not work in the healthcare sector might find that health reform offers opportunities for new and creative partnerships as delivery systems shift to patient-centered medical homes, health homes, and accountable care organizations. These new models of healthcare encourage networking among service organizations because they reward shared risk for patient care and provide financial incentives based on outcomes, not just visits. And I'm sure Jacqueline will have more to say about that later, both Jacquelines. So because of these new opportunities driven by health reform, we've been working hard over the past 2 years to figure out ways we might establish more stable financing for CHWs. This actually turned out to be an enormous amount of work. We thought we were just going to sit down in a group and come up with some recommendations for financing and get some feedback, and we're done. It turned out to be an enormous undertaking. We quickly learned from financial experts that in order to get stable financing, we would need a certificate to hang payment on. Nobody's going to pay for anything if there's no certificate to hang payment on. And we thought, well, okay, that was more than we intended, but we can do that. We can come up with something, a legitimate certification process. But then we realized that in order to have a certificate, we'd have to develop training that would be appropriate and available for CHWs. Well, okay, we thought, maybe we could do that too. But then we realized that in order to have training that was appropriate, we would have to hammer out a specific scope of practice that would determine the skill set that CHW needed to be trained for. So now this was huge. The CHW workforce is very diverse, and in efforts to embrace all of its possibilities, developing a discrete scope of practice was an enormous challenge. Well, I gotta tell you that at the time it all seemed to have gotten too big. It seemed beyond anything that we could possibly accomplish. But just as I was ready to cut bait, or to do it halfway, I remembered those CHWs who put together that first conference. On a hope and a prayer, they put together a conference for 120 people, and they fed them too. So I manned up. I took a deep breath, I recruited some amazing co-workers, and we set about the job before us. establishing standards for an emerging workforce in a way that would preserve the character and integrity of the work and be inclusive of the diversity and richness of the practice. We'll summarize that work in a session later this afternoon. For now, please know that the fruit of all these past 2 years is that we've generated recommendations to the State of New York and the Office of the Governor to advance our CHW workforce. And these recommendations include a discrete and comprehensive CHW scope of practice, very direct recommendations for CHW training and credentialing, and established models for CHW financing. But there was one more step missing. As has always been our practice, we needed organized CHW voices to guide and inform our efforts. We've always believed that only by ensuring CHW leadership in all policy and practice issues relevant to our workforce could we preserve the integrity of our work. And so, in spite of the enormity of the work before us, we would also have to find, support, and help organize CHWs in a number of locations across the state. As mentioned earlier in my statement, some of these efforts yielded amazing results. For example, we were able to find some of the original founders of the CHW Association in Rochester and support their reemergence and organizational development. The Community Health Worker Association of Rochester has now reorganized, grown, and become incorporated in the state of New York. And Shuar has partnered with the New York City network to develop a statewide association of CHWs, and are now poised to become the representative CHW professional association for the Western New York region. Congratulations, Shuar. In this partnership between Shuar and the CHW network of NYC, we announced today the formation of that very first statewide association. We look forward to our own organizational development and supporting other regional groups of CHWs to come together, grow, and join our federation. It is our hope that evolving CHW networks will form their own local and regional organizations with their own structure, autonomy, and governance, just like Western New York and downstate here have done, and that we come together statewide on relevant matters of CHW policy and practice. I'm almost there. It's been a busy 2 years, folks. But lastly, I would be remiss if I did not mention our leadership advisory group. Many of you know that it is wise to develop an advisory group when you're working on a project to help guide your efforts. We too knew early on that whatever came of our work was going to require significant change, systems change, structural changes. And so thinking strategically, we knew that we had to engage and recruit thought leaders and decision makers from all CHW stakeholder sectors in the public, private, and nonprofit worlds. We knew we had to engage them from the very beginning so they could contribute to the creation of our products and that the products would be appropriate and have their support. We called this group a leadership advisory group specifically because it was made up of first leaders from all the different stakeholder sectors. We'll tell you much more about this group when we report on our recommendations later this afternoon. Whew, I'm exhausted just talking about all that we've done. But I want to repeat that none of this would have been possible without the blood, sweat, and tears given by my immediate co-workers and the amazing support from all of those who contribute to this work. Thank you. So once again, I welcome you to the annual meeting of CHWs, the 7th annual meeting of CHWs, but a bigger one now because it's grown into a meeting of CHWs with our friends, our allies, and our advocates by our side. Welcome.